Okay, so moving on, we're going to look next at the thyroid gland and the parathyroid gland. So we had mentioned in the previous recording that the thyroid gland, right, is this butterfly-shaped structure here. And it's located in the anterior neck region, so kind of near your throat. And remember, if we kind of take our hypothalamus and our anterior pituitary, right, we have a thyroid releasing hormone, which goes down and targets thyroid stimulating hormone, and TH goes off and targets the thyroid gland. Now, within the thyroid gland, we have a number of cells, or a population of cells known as follicular cells. And these follicular cells basically line these big, huge cavities. So this purple space, or this kind of light pink hue space here, this is a kind of a fluid. We call it a colloid, okay? And basically, the cells here, these follicular cells, what they do is they produce, so TSH comes down and targets these follicular cells. And these follicular cells then secrete, okay, thyroglobulin into the lumens. So this is actually an empty space. Typically, so if you took out this pink, it would just be an empty space. A lumen again is the middle, is the opening, the hollow structure. Okay. Whoopsie. Okay. So we have our lumen, and inside this lumen we have our colloid. Okay. And this colloid is comprised of our thyroglobulin, which is produced by these follicular cells, okay, which is triggered by the production of TSH. Okay. And in addition to our thyroglobulin, we have a whole bunch of iodine. Okay. Now, the iodine and the thyroglobulin, okay, which exist in this colloid, are precursors to our hormone that is produced by the thyroid gland. And that is thyroid hormone, right? So we have TRH in the hypothalamus, causes the secretion of TSH in the anterior pituitary, comes down and targets the thyroid gland, and the thyroid gland then produces a hormone known as T3 and T4. Okay, so T4 is basically thyroxine, or one of the thyroid hormones. The thyroid hormone actually comprises of two hormones. And essentially what the 4 represents is the fact that it has 4 iodines bound to it. And then we also have triiodothyronine, which is T3, and that is basically 3 iodine, right? And that 3 comes from the fact that we have 3 iodines bound to it, okay? So thyroglobulin itself is not active, okay? You have to bind iodine to it. Once iodine binds to that thyroglobulin within this colloid, okay, we create thyroid hormone. Now, the role of thyroid hormone is substantial, okay? So T3 and T4 essentially play a role in every cell within the body. So it does things such as increases metabolic rate, okay, and body heat production. It regulates tissue growth and development. It maintains our blood pressure. There is a huge table in your textbook that shows you all the things that T3 and T4 do. Now, because it does so much, homeostatic imbalances of thyroid hormones have major implications. Okay? You have hypothyroid disorders. Okay? So this would be, for example, a hyposecretion in an adult. So in this case, what happens is, again, this will result in a decrease in T3 and or T4. Okay, so this can lead to something called myxedemia. Often hyposecretion of these hormones is characterized by a low metabolic rate. So typically they have an increase in weight gain. Okay. They're often cold. They can have constipation, dry skin, puffy eyes, edema. Okay. These two kind of go together because what happens is they retain fluid. You don't have as much fluid in your feces. Your feces becomes less liquidy, which causes to constipation. That fluid is then retained by the body. And these people can have lethargy, which means they're kind of sluggish and tired a lot. Now, the causes of hyposecretion or hypothyroidism, okay? One of those reasons, this is not every reason, but one potential reason is a lack of iodine, right? We just said in order to make T3 and T4, you need iodine. So if you don't have iodine in your diet, right, you can't make T3 and T4, okay? So that's hyposecretion, okay? And typically that is hyposecretion in adults, okay? Now hyposecretion in infants results in something called cretinism or congenital hypothyroidism. And this has a much larger kind of consequence in terms of the cognitive aspects of T3 and T4. So T3 and T4 deficiency in infants can lead to intellectual disability. They tend to have short, disproportionately sized bodies, thick tongues and necks. Typically, this is caught early on, hopefully prior to the onset of a lot of these kind of really strong effects within the body. Now, I do want to talk just a little bit. I'm going to back up one slide because I forgot to mention, I do want to talk a little bit about the regulation of T4 and T3. And again, remember, T4 and T3 are down here. Okay, and I mentioned on the previous slide, our pathway is the following. The hypothalamus causes the release of TRH. TRH targets the anterior pituitary. The anterior pituitary releases TSH. TSH targets the thyroid gland, okay? And the thyroid gland releases thyroid hormone, or T4, T3, and this targets every cell in the body. Now, when T3 and T4 levels are sufficient, what happens is there's a negative feedback. This negative feedback occurs and comes back and shuts off TSH and TRH. Okay? So in the case of hypothyroidism, okay, we just said there is a deficiency in T3 and T4. Okay, so in this case, our T3, T4 levels are low, which means this never happens, right? You never get the shut off. So what happens in individuals who have a decrease in T3 and T4, this often clinically is shown as an increase in TSH, okay? And that is because, remember, thyroid hormone will normally shut off TSH and TRH when levels are appropriate. Okay, think about a mug, right? Okay, you fill that mug until it's full, and when it's full, you turn off the switch, right? Let's say there's a hole in the bottom of that mug, i.e. that mug never gets full, right? And you have that mug in a bowl, right? Let's just say, okay? If that mug never gets full, the switch never gets shut off, okay? So if thyroid hormone is represented by the mug, right, and a full mug, okay, and it never gets full, that means the anterior pituitary and the hypothalamus are thinking, oh, I'm not making enough thyroid hormone. Let's increase the amount of TSH and let's increase the amount of TRH because nothing is shutting it off, okay? So typically, again, in hypothyroidism, where we have a decrease in T3, T4, we have an increase in TSH levels. We also have a hypersecretion homeostatic imbalance of thyroid hormone. And again, when we talk about hypersecretion, we're talking about an increase in T3, T4 levels. Okay. Oftentimes, this will result in something called Graves' disease. And Graves' disease basically is a result of an autoimmune disease. And again, not all hypersecretions are Graves' disease, but it's one of the more common causes of hypersecretion. Okay. And what happens in hypersecretion is you have an autoimmune disease where the body creates antibodies that target those follicular cells. Okay. And so you end up getting this overproduction of T3, T4. And so in these patients, what happens is they typically have a high metabolic rate, right? They have too much T3, T4. So they tend to have a sudden weight loss as opposed to weight gain. T3 and T4 hypersecretion can lead to rapid and irregular heartbeats. They tend to have nervousness. Here's that weight loss. And again, that weight loss is due to the elevated metabolic rate. And their eyeballs protrude from out behind, from their eye sockets. Okay. So that's thyroid hormone and the homeostatic imbalance associated with thyroid hormone. Now we're going to move on to a series of glands that are actually located on the posterior aspect of the thyroid gland itself. However, these glands don't have anything to do with the thyroid gland itself. They're basically just haphazardly located on the backside of the thyroid, and this is why they are called the parathyroid glands. Now, there can be 2 on each side, there can be 3 on each side. In general, there's anywhere from 4 to 8 of these glands on the posterior aspect of the thyroid gland. And the parathyroid gland, produces a hormone known as parathyroid hormone. Now, that may be a familiar hormone to you guys, and hopefully it is, and that is because we talked about parathyroid hormone, excuse me, in AMP1 when we talked about blood calcium levels in our bone chapter, right? We talked about the role of parathyroid hormone when our blood calcium levels decrease and how PTH targets osteoclasts in our bone and causes those osteoclasts to start to chew up the bone, releasing calcium into the bloodstream. Okay? What I didn't tell you at the time is that is actually only one of 3 things that that PTH will do. So all 3 of these events are triggered by a decrease or hypocalcemia event, or a decrease in blood calcium levels. So this decrease in blood calcium is triggered or sensed by the parathyroid gland, causes the release of PTH. Okay. Again, we have that bone effect on bone, which we know from AMP1. But the 2 other things that PTH does, okay, is one thing it does is it actually targets the kidneys and causes a reabsorption of calcium out of our tubular system, okay, and back into the body. Okay, so we basically send PTH to the kidneys and say, hey, kidneys, I don't want to lose that calcium via urination, so can you bring it back into the body? And it brings it back into the body. Okay. The other thing that PTH does is it actually increases activation of vitamin D by the kidneys. So again, PTH yells out at the kidneys. Okay, it doesn't really yell, but you guys get the gist of it. Hey, kidneys, I need you to activate vitamin D. Now, you might be like, well, what is the point of activating vitamin D? And that is because when we consume calcium in our diet, which is the only way we can get calcium, we can't make calcium. Obviously, we store calcium in our bones, right? And we have both calcium in our bloodstream. That's why we can pull it out of our kidneys, okay? But we can't make new calcium. Okay, so if we're really deficient, if we consume a meal, we have calcium in that meal, okay, the only way that calcium is actually absorbed out of that meal and into our body is if it's bound to vitamin D. Okay, so what will happen is we increase vitamin D activation, And this increases our calcium reabsorption or our calcium absorption from our food within the small intestines. Okay? All three of these events ultimately result in an increase in blood calcium levels. Now, a homeostatic imbalance of parathyroid hormone, hyperparathyroidism. Okay, again, this is a too much PTH. Okay, this is often due to a tumor. This results in bone softening and deforming. Why do you think this is? Think about what we just talked about, right? PTH, calcium levels, they don't care about the bone integrity, so you increase PTH, you basically start to chew away all of those bones. Now the problem with that is not only do you get bone kind of consequences, but an elevation of calcium actually depresses our nervous system. Okay, so now you start to have cognitive functions as a result of the simple ion that is basically too much. We have too much in our bloodstream. Okay, calcium, excess calcium or hyperparathyroidism can also lead to a type of kidney stone. Okay, now hypoparathyroidism is typically due to trauma to the gland. So, for example, if you have a patient that has thyroid cancer, and they remove the thyroid gland, you also subsequently then remove the parathyroid gland, right? So you have to compensate for that in a patient who has thyroid cancer, because by removing that gland, you also have consequences to calcium level regulation, okay? And that regulation is really important, because if we don't have that regulation, we don't have that calcium balance, this can lead to tetany. Okay, it can lead to respiratory paralysis and even death. Okay, so taking the thyroid out just because you have thyroid cancer, right, isn't just as simple as just taking it out and you basically cure the cancer and it's all taken care of, right? Because you have this other crazy gland that's attached to that thyroid gland, okay, that is really, really important for the body. Okay, so that basically entails the thyroid gland and the parathyroid gland and the hormones secreted from those tissues.